Today, we will be discussing everything you need to know in order to succeed during your clerkship rotation,
as well as the basic tools you will be needing to carry them along with you during the rotation and the review materials which will help you.
I'll be providing you with the list of clinical tools that you'll be requiring during your rotation.
I will also enumerate all physical examinations that you need to know in order to succeed.
And I will guide you with the best pocket guides so that you can crack your exams and study well.
So without further ado, let's get started! Now onto the diagnostic tools. So you will need a diagnostic bag. This will help you keep all your diagnostic tools in one place and allow nothing to be displaced. Then you would need a notebook. This will help you keep track of what the patient has said during the history taking as well as various other forms of information. You would also need to have a BP cuff. Then, a pulse oximeter. The pulse oximeter will help you determine the patient's O2 saturation as well as the heart rate and pulse rate. Then, a pen light. Make sure the pen light is working at all times. You'd also need to have micropore on hand for when you're doing blood extractions. A stethoscope is always very good to have on hand. Then, a neuro hammer, as well as a tuning fork, which will help you when doing neuro exams. This is particularly important when a patient comes in with stroke. A calculator is also very good to have when in your pediatric rotation to help you calculate the different dosages of the medication. A tape measure is also very good to have during your OB rotation as well as your pediatric rotation. Then, a tourniquet is very good to have on hand because this one will help you with the blood extraction. Then lastly, it's always very good to have a working thermometer on hand. These ones usually get replaced very quickly because the battery life is very short, so keep many on hand. All in all, I'd like to remind you that you are just training and you are starting out your medical profession. In this time, there's no pressure for you to get brand name gear as well as very expensive equipment. My pro tip to you is that you should remember you are still training. So there's no need for you to buy expensive equipment because as a clerk in the hospital, the doctors and nurses would often ask to borrow your things and you do not want something to go missing.
So for the skills to know as a junior intern, try to get familiar with taking a patient history. Try to memorize the format so that you may ask the questions in a systematic way. Remember that your patient might not think that all details are relevant, so it's our job to elicit this information in a friendly and polite manner. For physical examinations, all physical examinations are important, and you'll get better with more practice. Try to know how to do the basic vital signs for your patient. This includes familiarizing yourself with using the BP cuff, taking the RR or the respiratory rate, the heart rate, the temperature, capillary refill time, and O2 sats of your patient. Focus on refining your knowledge of the physical exam and urological exam. Remember, not everyone has nursing or medtech as their pre-med, so extracting blood or inserting a cannula will sometimes be tricky and maybe even nerve-wracking on the first few attempts. Remember, just don't give up. Once you're back in the hospital setting, you have ample time to practice, so you'll definitely get better with these skills. Until then, stay safe, stay at home, and try your best to practice amongst friends and relatives. And remember to always ask permission before trying these things. For further information, you can use our Oscar videos as your guide.
As a junior intern, you need to have the ability to answer anytime when your intern or a resident asks you questions. So, to make your life easier, we have some of the handbooks which are useful for a quick revision and for memorizing faster. Don't rely on the technology because the doctors want to see you reading through the books. Here is the Platinum series, which is good for internal medicine, surgery, OB, and these, as you can see, they are very small so that they can come in your diagnostic bag as well. And these are packed with facts. criteria, definitions, and much more. These books have helped me a lot during my rotation, and I recommend them for you. In addition to these books, we have other handbooks like the Harrison's and the Merck's Manual as well. Don't forget to download the MIMS app in your phone, because you will be asked to help prescribe medications, and you should be able to know the generics and the brand names, the route, the frequency, the dosage, and mode of action as well.
So, my fellow junior doctors, med students and nursing students, this video is just an overview of the Clerkship. If you haven't already, please subscribe so that you may be notified of our Oscar videos.
So let's share the love and share the knowledge, and let's share this video with your fellow doctors, classmates and juniors, and let's help them as well.
Thank you for your support. Stay safe and stay blessed. But before you leave, I want you to comment which tool do you think is the most important during the clerkship.
Bye! Oh my god, it was very funny.
Okay. And don't forget to watch this video. Comment.
As well as the basic tools one must carry.